This episode is proudly sponsored by Morpheus Publishing, helping people with lived experience turn their stories into powerful published books that inspire, educate, and create change.
Visit www.morpheuspublishing.com.au for more information.
Welcome back to the Lipoedema podcast. We are your host, Shell.
And Tiana, and today is our co-host episode snack.
Our little snack episode.
Our little snack, but it's a meaty episode because Shell has had some new diagnoses in the past couple of months, and I am really keen to hear absolutely everything about it.
Yeah.
Let's start with what your new diagnoses are.
Okay. So the first one was EDS, which I always sort of thought, but I go to the doctor and I mention it to him and he's like, oh, can you put your thumb to your forearm? And I'm like, well, sort of. But no, he's like, no, you don't have it. But I think I've heard that they are changing the diagnosis and how to get the diagnosis, because I can stand up, I can put my hands flat on the ground when I do touch my toes, I put my hands. So So I've got hypermobility in my elbows, shoulders, hips, and knees. And the SI joint, which is I can't remember what its actual name is.
Mid-back?
Yeah, right down the bottom of your back there. Apparently it's not supposed to move, but it moves. It flexes, and that's where a lot of my back pain over the years comes from. So it's that joint then goes out to my hips, and it's just all awful. So I searched up a physio who specializes in EDS.
Yeah.
So I thought, I'm pretty sure that's what I've got. Let's go to someone who knows about it and get it sorted. And she gave me a clinical diagnosis, straight away. She went through it, gave me a clinical diagnosis, gave me exercises to do and all of that sort of thing. But I haven't got a medical diagnosis as yet.
Gotcha.
Because when I went to my doctor, he's like, yeah, that the thumb and forearm thing. And I went, okay, you're not my guy anyway.
Yeah.
So I had that. And then recently I've been seeing Josh, who is a diagnostic dietitian. So he does heaps of testing to then figure out what your body's doing. And so I went to Josh and I told him about the clinical diagnosis of EDS. Anyway, so he started with some blood tests and he did a DEXA scan. And then I went back a month later and he did all of these other tests. And one of them was the POTS test. And I failed that. So I have POTS as well.
Can you talk about how they do the POTS test?
Okay. So I had to lay down on a bed and he was taking my blood pressure every minute on the minute.
Pulse or blood pressure?
Blood pressure.
Okay.
Yeah, so I had a blood pressure cuff on. So while I was laying down and he's just telling me to breathe normally. And so he got that baseline. I think I did 3 minutes laying down and then I had to stand up and not move, just stand up, and he kept doing it. And my blood pressure just crashed. And I got to 9 minutes and I said, is this the last one? I can't do this anymore. He said, I can't believe you lasted that long. And then he showed me how he was tracking it. And I'd actually crashed at the 3-minute mark, but I just pushed through. He said, you're so used to pushing through that you just kept going. He said, and I could see you starting to struggle and you just kept going. So I don't understand all the technical terms because I'm not a doctor or a nurse, but the high number on your blood pressure and the low number, mine had almost come together. There was 5 points between them.
Right.
So what's happening is when I stand up, the blood and fluid, everything is rushing to my feet, is what I sort of understood from what he was saying. So my body goes into a physiological fight and flight. So everything shuts down.
Wow. And so data aside, what do you feel when you have to stand still?
Tingling in my fingers. My fingers start tingling and my feet. And then I just start feeling warm all over. And then the side of my face goes numb. There's no feeling in the side of my face. And then I'm just really short of breath. And I've always, I have a fear of drowning. or of not being able to breathe. And that's probably why, because that happens to me and all that stress response.
Yeah.
So that's probably why I have that fear, because it's actually real.
Mm.
Mm.
That's so interesting.
So that was really wild.
So that POTS test is quite easy to do with someone who knows what they're doing, right?
Yeah. Yeah. Yeah.
After you got your POTS diagnosis, I called my GP and asked if they could do the POTS test. And it was interesting because they said, we can do it. We just check your heart rate while you're lying down and then check your heart rate while you're standing up. And I'm like, heart rate? Like question mark? I'm like, yeah, heart rate, like pulse. Check your
Ah.
pulse. And I was like, okay. And because we'd had this conversation,
Yeah.
I was like, oh, not the blood pressure.
Yeah.
And so I don't want to get it done with my GP because I feel like the medical diagnosis compared to clinical diagnosis, as you mentioned with your EDS, must be different.
Yeah.
Yeah. And if it was pulse, I could actually probably do it at home by myself with my Garmin
Yeah,
because
that's
my
right.
Garmin has a pulse rate. So I'm
Mm.
confused and I don't understand. And then when you just said about like that differentiation between the score, the like hypermobility score that you would get from a medical professional and the hypermobility that you get from another type of like a clinical professional
Yeah.
is different. Well, maybe it's different for this one too.
Yeah, maybe.
Mm.
And so what I will do is once I get all the reports from Josh, I'll take them to my GP and say, here's the clinical diagnosis.
Mm.
Like it's been done, write it up.
Yeah, yeah,
Yeah,
totally.
because I've had
That's a
it
good
done.
idea.
Yeah, so that's
Yeah.
what I was thinking, because they don't have the time to do the testing and they aren't as, they've got so many things they have to be across.
It's a limited scope, like
Yeah.
the EDS, like the hypermobility one. It's like if you can't put your hand there, you know, you don't meet the brief. Because
Yeah.
I don't meet the brief,
Yeah.
but I also am on the hypermobility spectrum, as I recently found out, because I meet certain other criteria in an aspect. Now, I don't have Ehlers-Danlos syndrome,
Yeah.
but I do have some form of hypermobility.
Yeah.
And it's good to know
It is
because
good
it
to know.
can explain things.
Yeah.
Talk about, because that back, the spine situation, a lot of your, when you've been working out in the past, a lot of your injuries are back injuries.
Yes. Yep. And so what I've been doing is, because I can bend over and touch the ground, bending from my hips, I do
When you're picking up
when
stuff.
I'm picking up stuff. So
Yeah.
even when I'm doing weights, because my body can do it, I do it. But then I'm adding load onto a not, not a strong joint, or a joint that's not supposed to carry load. I'm adding load to that, which is then putting all the muscles around that joint, spasming to protect the joint, which is what the back pain is.
It's so interesting that you mentioned the bending down because I saw something on social media the other day talking about the deadlift, and the cues for a deadlift are different for hypermobile people because just like you said, you can touch the ground, and most of the cues, the normal cues is to get down as low as you can, knowing that most people can't get down that far. And so everything's all activated the right way. But for hypermobile people, your cues are different, is get down to just below the knees and then come back up using the musculature that you need to use. And I think that speaks to people that have hypermobility. If they're going to see a fitness professional, that fitness professional should have knowledge about how to train someone with hypermobility or Ehlers-Danlos syndrome.
Yeah, absolutely. And you've got to do a lot of work on those joints, strengthening those joints and the muscles around them, and learning how to activate the right muscles instead of just doing the movement. So yeah, I've got something to follow that I should do, but it's boring.
Yeah, that
I
sucks.
get bored.
Especially because you're used to working out a certain way. Like you were in a flow of working out when we first met.
Yeah.
You really liked strength training. You were doing it with your daughters.
Yeah.
Being then asked to or told to change something that you got into a habit of and you enjoyed because it was habitual
Yeah.
is so hard.
Yeah.
So what are the things that you now asked to do?
So a lot of it is strengthening that SI joint that I was talking about. So a lot of just like laying flat on your back. Like I have to tilt my pelvis in a certain way to engage the joint, and then like doing bridges and then putting a ball between my knees and pushing the
So like
ball in.
Pilates.
So it's sort of like Pilates, and it's sort of like that functional type
Yeah.
movement stuff.
Mm.
It's just boring.
Yeah. Yeah.
But I know I need to do it if I want to get better. So maybe, yeah, that's something I'll look at including when I get a chance.
Mm.
And not forcing myself. Like I think I have to do it. And then, yeah,
Yeah. There's no point doing exercise that you don't like doing.
Yeah.
So, is there anything else with your Ehlers-Danlos syndrome diagnosis that you now join the dots with for how you've been feeling?
Yes. So my gut. Like I have had gut issues since I was a child. Like my mum said when I was a baby, I just screamed all the time. Like she could not figure out what was wrong with me. And so what I've been explained, so it's not too much information, but it might be a bit cringy. I have like fecal loading. So where feces isn't getting through my transverse.
The maze.
Yeah, the maze of colon and intestines. So with EDS, that there's this top part of your colon where it sort of goes up and then gravity feeds down. That's how it's supposed to go. But with Ehlers-Danlos, because our muscles, ligaments, connective tissue is floppy, that doesn't have that gravity. It goes straight across. So I have like just fecal matter just sitting there and it can't get out.
Wow.
And you can't fix it.
Yeah.
You just have to manage it. So you need to make sure that your stool is softened at all times so that actually can move through. So that explains like, 50 years of tummy upset.
Wow.
Yeah.
And then managing that is, in my mind, it's obviously fiber.
Yeah, I'm thinking it'll be, some sort of, fiber and lots of water. With POTS, you have to make sure you have salt in your water. Like that is like your electrolytes. You've got to make sure that you're balancing your electrolytes. That's like one of the key things for the POTS. So that's wild.
Yeah.
And it also like, it's weird because I always knew I was hypermobile, but I didn't associate that with my pain or weakness. I thought that was lipedema, but it's not. It's like causing its own pain because it gets inflamed when I, put load on in the wrong way. So,
And it's not even physical load like weights or anything. It's like bending down to pick up something light as well. You're still hyperextending things.
absolutely.
And then using joints to pull yourself back into place.
Yeah. Even unloading the dishwasher.
Yeah.
Because I bend from my hips because I can.
Because you can.
Instead of bending at the knees.
As someone who has lived a life of dancing, I often bent at the hips and not at the knees because I could.
Yeah.
And I would pick up things, with straight legs and I don't know why. I think it was the culture of being a dancer. I don't know. I don't know why. It's very weird. It's not like it's more delicate and it looks a bit weird, but
you were keeping those elegant long.
Yeah, it's weird.
Very graceful.
But like I could see how as you get older and like that hypermobile people would really struggle then, like to change the pedestrian movement that they're used to doing.
So used to doing it.
Yeah.
Yeah.
So what is that like now that you know, and we spoke about the Pilates being boring, but like just that pedestrian stuff, how are you going psychologically with either changing or noticing and then changing some of that pedestrian stuff?
Yeah, I'm definitely more aware of what I do now. Like even like unloading the dishwasher or I've been doing some heaps of gardening at home, like getting rid of some trees for my renovations.
It's hard work.
And even when I've been sawing trees, I've been making sure I bend my knees, leaning over and sawing the trees. And I didn't hurt myself. So it is working. So yeah, I just have to be mindful of it and listening to my body as much as I can. And I think the beauty of gardening is it does make you just mindful because you're looking around the garden and you're looking at things. And like you're not really off with the fairies thinking about the other 1,000 things you got to do.
True.
You're actually there. So yesterday I was loading the car and I'm like, oh, what's the best way I can load all these trunks into the car? And yeah, so I didn't hurt myself, even though like we took like 15 tree trunks to the tip
Mm.
to the green waste. Yeah, I didn't hurt myself because I was very mindful of what I was doing. I was bending my knees. I was using the trunks to lever themselves, like to lever them into the car. And yeah, so it's just slowing down enough to be mindful of what I'm doing so I don't hurt myself.
Look, that's very different to how you would approach it before your diagnosis.
Absolutely. With everything, like with my
Yeah.
mental health, with everything I've been through, that slowing down has been key to everything. And I actually, the last 4 weeks, I did a bit of a spiral into diet culture and I was in a really terrible place. And I don't know, but like I switched from Ozempic to Manjaro. And then the doctor said, go on these OptiFast shakes and see if we can get some weight off. And it was just a slippery slope to diet culture health. And I even found during those 4 weeks, I lost my mindfulness. I was just go, 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 go.
Yes.
And then once I realized where I was at, I was able to, recover, not quickly, but I was able to recover. And, I started putting things in place. I've been getting a good night's sleep. I've been waking up at 5:30 instead of my usual 6:30 because I'm going to bed earlier.
Mm.
And yeah, I was able to listen to my body. And I think that really is key in all of this
Mm.
because we're never taught to trust ourselves.
No, and it's interesting, the trust issue, because I feel like you have a sense of where your body's at. I remember at the beginning of the year when we were discussing our goals, and even before we discussed it on the podcast, you were actively trying to be more mindful in your everyday tasks.
Yeah.
And I feel like that's a symptom of you being deeply knowing, like not understanding why, but that deep knowing about what you might need. And then it's that knowing, like knowledge to action sort of thing, can take some time or can flip backwards or whatever.
Yeah.
But you purposefully did that at the start of the year because it was one of your goals.
Yeah.
And it's obviously serving you well because it's the practice that started before you got this diagnosis.
Yeah, that's right. And I was saying that to, I think I was talking, it must have been my mum. I was, talking about this, spiral that I'd been on. And I said, but like, that's the first time it's happened this year. Whereas usually that would happen maybe a couple of times a year more.
Mm.
But that's the first time it had happened. And when I picked myself up from it and went, oh, this is happening, I made a psychologist appointment. And I just kept remembering how I felt before.
Yeah, okay.
Yeah, because I had that. I'm like, I was in this space where I was noticing things because I was present. I was here. Yeah. And so it was really good to have that clarity wash back over and not, set up camp in this hole I'd found myself in.
Yeah, and snowball.
Yeah.
I think it definitely, like, something really important that I used to think, like, resilience and picking yourself up was leading to the absence of discomfort. Like, I used to feel like the goal was to not feel discomfort.
Yeah.
But actually, like, the resilience and picking yourself up is actually being able to do that in discomfort.
Yeah.
And it's a very different way of thinking because it's not a destination. Like, you don't do this to get to this point where you don't feel like discomfort is the point.
Yeah.
And then
Yeah.
us managing that discomfort is actually the point,
Yeah.
the wisdom.
Yeah, that's right. Yeah. Because you can't, like, with everything that is going on in the world, with our bodies, with everything, we can't just erase it and go, okay, I'm healed now. I'm better now.
Mm.
We've just got to learn to live with it, walk with it. And yeah, that resilience is being able to be in discomfort, but seeing the best in everything anyway.
Yeah, still having the discomfort as part of you, not
Yeah.
not
Not
your whole.
defining you.
Yeah.
Yeah.
I wanted
Absolutely.
to just concentrate on the psychological aspect of new diagnoses.
Yeah.
Just your kind of, like, this year we're coming from a place where Shell needs to look after yourself mentally
Yes.
a lot and deal with some really traumatic things that happened last year. How then does receiving 2 new diagnoses impact on that mental well-being?
Yeah, it actually, it answered some questions. Well, not quite. No, I didn't have questions, but it gave me more understanding. So POTS is send your body into a physiological flight and fight. So even if mentally you can calm yourself, your body can go into stress and set you off.
Mm.
So that's really interesting because I hadn't thought too much about that before, that your body can so much affect your mental health just by the chemicals that it releases.
Yeah, yeah.
Yeah, I know that sounds simple saying it now, but I've always sort of been, "Oh, that's a head thing, that's a"
Yeah.
you know what I mean? But it's not.
Yeah.
Like, it is all connected, and yeah, so it actually answered some questions for me because 'cause I'm like, some days I'm happy, I'm doing everything I wanna do, and then all of a sudden, when I was going to the gym, I went into the sauna one day and I came out and I thought I was gonna pass out, and I'm like, "I always go in the sauna, what's going on?" And that was probably should have been my first sign of the whole POTS thing.
Mm,
But yeah, and I was just feeling terrible, like absolutely terrible
mm.
and my body had gone into this fight or flight response. Yeah, because it overheated.
And so just having answers gives you a bit more clarity about how your physical state can impact on your mental state.
Absolutely.
Yeah.
Yep. Absolutely. And even to the point where, like, so as I was saying, we've been doing some renovations at home. And I used to get upset if I couldn't do as much as I'd wanted to do.
Mhm. I remember.
Yeah. Whereas now it's like, okay, today I just have to do that bit.
Okay.
Whereas usually it'd be like, get it all done, rah, 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 because I was right or wrong, brought up to not be weak.
Yeah, totally.
Like, so I've always had to fight through everything. Like, don't be show weakness, don't. And so
Mm.
for me now being alone and having to do everything around the house, or, this stuff that we're doing with chopping down trees, because I'm home, no one else is home. I'm like chopping down the trees and I'm doing this and I'm doing that. And then I'm like, okay, that's enough for today. And I take my puppy dog because she's absolutely loving being outside in the garden with me. I take her in and we go lay down because my face will be red hot. I'll be sweating. Like, I'll go outside and it's cold and I've got a hoodie on. Within like 3 minutes, the hoodie has to come off.
Mm.
And I've realized that I can only do a certain amount. And now looking back at my, strength training and stuff, I was probably pushing myself too hard,
Totally.
doing too much and not knowing. I would think, "Oh, I'm hot, I'm flushed, I must be working hard." But in actual fact, that was my body saying, "We're done now. We need to
Mm.
go and have a bit of a rest, get your blood pressure back down." And yeah,
It's no longer a sign of achievement to push through.
yeah, absolutely. And if I can only do half an hour outside, well, just do half an hour outside.
Yeah, that was my next question. Like you mentioned that your goal is to do less, but is that like when you're structuring that in your head before you're doing a task, is it achieve a certain thing or is it a certain certain time frame?
No, it's more achieve a certain thing.
Okay.
Yeah, because I don't know how long it's gonna take me.
Yeah.
Because when I wanna do something, I'm quite tenacious
Yes.
and I get it done. So it doesn't take me long. And that's what surprised me. Like, I chopped down all these trees just with a handsaw because I couldn't find a chainsaw or anything. So I've chopped down all these things with a handsaw. I'm like, "Oh, I'm done now." I go inside. It's been half an hour and I've just chopped down like 7 trees. I'm like,
You just went for it.
just went for
Yeah.
it. So yeah,
But
I'm not
mindfully.
mindfully.
Yeah.
Yeah. Yeah, yeah, making sure no one's getting hurt. I was, like, bending over and doing all the things and then trying not to squish Daisy when the tree fell down.
Little Daisy so small. I mean, it's good to hear that like the diagnosis brought you answers and validation, but also is leading to being able to like take care of yourself a bit better. Like
Absolutely.
give
Yeah.
yourself more grace.
Yeah. Yeah. And that's it. And like I was saying before offline, like, I really need to work on protecting my peace. And I also need to stop thinking I need to not do everything, but be across everything at all times.
At all times.
And I got a new phone yesterday and I've only put my personal email on there. I'm not putting any work emails on there. I'm not putting anything else on there. I'm just going to leave it. That's just my phone
Yeah. Gosh,
because
that's
I know.
Your battery's going to last 5 days.
I know. But I'm just because I was finding that, like, if I read a message about something, I felt I had to do that right now,
Yeah.
and that wasn't good for my mental space too. And because I have so many hats on at the moment, like, even though it's weird, I'm not working, but I have all of these hats
You
on.
filled your time up very well.
I have.
Not having a formal full-time job.
So I've had to make sure I'm, doing, like, because Friday's a podcast day. So Friday, I look at everything for podcast. Monday, Lipoedema Australia Day. They're my Lipoedema Australia days. I'm now doing a return to work program with Prioritise Kids, which is teaching kids how to deal with their trauma, which is so in my
So
wheelhouse.
exciting.
I'm so excited for that. But as work, because I'm on work cover have said I can do 2 4-hour days a week. So that will be, Tuesday, Wednesday, or Thursday, depending. And, I've just got to stick to that
Yes, for your health.
for my health.
Yeah.
Yeah.
Yeah,
Because
it's
that's what
high
burnt
stakes
me
now.
down last time.
Yeah.
Like, I burnt down thinking I had to be all the things, do all the things, show up all the time, because that's where I based my worth.
Yeah.
My worth was what I could do for other people.
And it's not.
It's not.
It's not.
It's not. So, yes. So
That's really cool. That those boundaries are so cool. Can't relate, but like super admire.
yeah. Well, it's only day one. Yeah.
She got the phone yesterday. The intention is there. Yeah. Love that. That's so interesting. I am really keen to hear later on down the year how like the management of those new things alongside your lipedema like progresses.
Yeah.
Because it's still like the foundations will always be the foundations, but it's like what extra things just helps you in everyday life. And as we know with lipedema, that's experimental. So you don't need to have all the answers now.
No.
And so maybe we do another check-in later on in the year and see how you're managing those things.
Yeah, that sounds good.
Yay! Well, until our next episode.
Thanks for having me.
Bye!
Bye. Lipedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipedema podcast. Until our next episode, bye for now.
Lipedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipedema podcast. Until our next episode, bye for now.